So today we're going to go over one of the most common questions that we have after we get done with a hearing assessment.
Yes, and that is, what percentage hearing loss do I have? We matched today.
I noticed that.
I just noticed it. We went all day and
we look
matched.
really good.
Nice.
Hey, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you're not sure what audiology is, make sure to hit our like button and subscribe to our YouTube channel. Hit the little bell notifications and we will tell you all about it. All right, one of the biggest questions or most frequent questions that we get after a hearing test is, all right, doc, I've been told that I have 50% hearing loss. What does your testing show today? So what does that actually mean? Because we as audiologists don't necessarily think of hearing loss in terms of a percentage.
That's right. So when we are testing your hearing, we'll kind of start at the beginning here. Right. We are testing your brain and your auditory system's ability to detect soft sounds, first and foremost. So that's where, and if you've had a hearing test, you can remember maybe you've heard all those different beeps, you pressed a button or you told us when you heard that, and across different pitches in each ear, that shows us your brain's ability to detect soft sounds.
Right, they're threshold measures. Mm-hmm. We're looking at the softest sounds you're able to hear at that particular pitch. Mm-hmm. Okay, so that will give us the type, degree, and configuration of the hearing loss. Yep. See, that's what we look at.
So that tells us where is the hearing loss happening in the
right.
auditory system based on the testing that we've done. How severe is it? So
right.
what degree is it there? And what does it look like on the graph? So the shape of it, that means a lot to us in terms of what we can recommend or what, treatment.
But how much does that really mean to our
you?
patient?
Yeah. So a lot of people think in percentages, which is why a common question is, all right, what percentage of hearing loss do I have? And I think it's tempting for us to say, can't really tell you that because it's a logarithmic scale and we go into this explanation. But what we wanted to do today is talk about two different ways we can give a percentage based on the results.
Right, so one of the first ways that we can give you a percentage is just simply by looking at the audiogram itself or the hearing test itself. We look at what's called the articulation index. And I personally love the articulation index as a counseling tool because it means a lot and it makes a lot of sense. So the articulation index is basically just a graph of all of our speech sounds put on basically an audiogram that's labeled from low pitches to high pitches and soft sounds to loud sounds. And wherever your hearing test kind of intersects with that graph, that gives us a percentage of sounds that are audible or accessible to the ear. And you do it for the left ear and the right ear.
Right.
So what that tells us is how much sound, or what speech sounds I should say, that you can actually hear at each pitch.
Right, so that's access to speech sounds.
Right.
And then beyond that, the other percentage that we look at is your word understanding or word recognition score, which is a little bit higher level, I guess, than that, because it's your brain's ability to understand and interpret it. So you'll be asked to repeat back some words without lip reading, without any context clues. It's a single word. So that's really taking an isolated look at each ear and your auditory system in that ear and really know how your brain and your auditory system is interpreting and understanding that. And so that gives us a percentage of how much word understanding you have.
There's one other percentage that we sometimes will look at. Unfortunately, it's not really covered by insurance, so that kind of makes it difficult to do for every single person if they don't want to. But we also look at a percentage of how a patient is able to understand speech in the presence of noise. What we know is that many of our patients significantly struggle when there's background noise present. But we can actually gauge at what level that breakdown starts to happen. And it really helps to determine outcomes with treatment, whether it's hearing aids or oral rehabilitation or something like that. So that's one other percentage that we can look at is how much or how little do you struggle when background noise is present. And that kind of closely relates to the speech understanding or word recognition abilities there too, because you can have really good word recognition until you put some background noise in there, and then that can drop drastically. And that's a matter of auditory processing, which we'll talk about in another episode on another day.
Absolutely. So I think in summary, what we've tried to do today is give you a way to really understand what measures you are getting when you have a hearing exam or a hearing test, and to try to be able to understand what some of those percentages or scores may mean. So if someone does tell you you have a 65% hearing loss, what exactly are they measuring with that percentage? So be sure to ask that.
Yeah, definitely ask that. And if 65% of what? And if they can't answer that question, then maybe we need to find a provider that can.
Maybe so.
Maybe. We hope that you guys learned something today. If you have questions for us, give us a call, 304-428-2403, or definitely shoot us an email at info@hearwv.com.
That's right.
Make sure to like and subscribe to the channel. Give us a shout, give us a comment. Let us know if you have any ideas for other topics. And until next time,
Thank
we'll
you.
catch you later.